Hi, my name is Shuba Iyengar. I'm the Chief Medical Officer at Allermi, and I'm here to answer questions about, environmental allergies, seasonal allergies. Feel free to ask. Let's look and see what questions you guys have. I can tell you a little bit about myself. I am a mom. I have twin boys. I live in the San Francisco Bay Area. I did my allergy training in Boston, partly in Boston at Children's Boston, partly at Stanford. I've been lucky enough to work with our awesome team at Allermi. It's been fantastic. They're all really great. I've loved meeting people and sort of helping people who have allergies because it really affects your daily life. And so I completely understand. One question is, can you talk about why allergy symptoms can be bad while the pollen count is low? That's such a good question. There are so many reasons why that could be. One way to think about it is that when you have allergies, your nose is always a little bit swollen, but to some extent, like you can get by. Like if you can't breathe through one side, you'll just breathe through the other. And if you can't breathe through the other side, you'll just start to mouth breathe. But let's say you get like sick with a cough or cold. That nose that's already a little bit swollen will now swell shut. And then all that mucus that wants to come out can't, so it's going to start to go backwards in the back of your throat. Ha, 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 ha. You'll end up with that tickle, or it'll go into your sinuses and you'll get that sinus pressure and pain. And so even though the pollen counts might be low, you can still get like sick on top of having allergies, and that can make your symptoms worse. What can also happen is even though the pollen counts are low, like the wind count can be high. And so even though there might not be that much pollen in the air, it'll just blow over to you. And so that can also make your allergies worse as well. So there are a lot of factors that go into why your symptoms might be bad, even though like you look at like the pollen map and it's not that high. So that happens a lot. Unfortunately, also in climate change, we see that. Question was, I've tested negative to allergies in the past, but I still find myself very congested. Why is that? Such a good question. So one reason that I see in my patients is that sometimes when you move to a new place, there's a honeymoon period. So it takes like 3 to 5 years for your testing to kind of show up positive. And so you might still be getting symptoms, but your testing can come back negative because you're still in that honeymoon period. So sometimes you just have to retest like in a year or 2 years. Sometimes you're on a medicine that interferes with the testing. Most of the time, like the allergist or the allergy nurses will send you information on what meds to stop before the testing. But there are some kind of meds that, even though they're not on the list, they sometimes interfere, like anti-epileptic meds I found, and sometimes meds that are used for depression, even though they're not on the list, they sometimes interfere with the testing. Sometimes I don't really know why it comes back negative, but then I test again in a year or two, and it usually ends up coming out positive. And in the meantime, I just treat my patients as if they have allergies, and that usually works out pretty well. Another question was, I've had every test there is. Sometimes it seems like you've had every test there is. Nothing shows up. What could be causing all my allergy symptoms? There's also the possibility that you have like a non-allergic form of nasal congestion. Things like smoke, perfume, strong smells can cause that nose to get irritated. And when the nose in the inside gets irritated, it starts to swell. And when it swells, you get mucus, and then things that want to come out, like that mucus can't come out, and so it goes backwards, and then you get the sinus pain like we talked about, or you get that on the back of your throat. So there are other things that can cause that nose to get swollen. It's not always pollen. Someone else had asked about something called sublingual immunotherapy, which is like an allergy pill that you can take. They specifically have it for certain allergens, and they're FDA approved in the US for dust mite and for grasses. There is definitely some studied benefit from taking oral immunotherapy, sublingual immunotherapy is what I meant, while you're taking it. It does, has been shown in studies to improve symptoms. Most of the time after you stop sublingual immunotherapy, there might be a period of time where your symptoms still stay pretty improved, but there is a possibility that your symptoms might come back again. But for the most part, my patients who have been on sublingual immunotherapy have been very happy. The other catch is that, if you're allergic to one or two things, sublingual immunotherapy is really helpful. Like it can be really effective. But if you're allergic to like more than 10 things, which is many of us, oftentimes allergy immunotherapy or allergy shots is much more helpful. Oh, and then someone asked about oxymetazoline. So oxymetazoline is the main ingredient for a lot of nasal decongestants that are out on the market. You've probably seen it at your drugstore as Afrin. And with that, at the standard strength that they sell Afrin in, we tend to not recommend using it by itself because it can cause what they call rebound, meaning that after you use the standard strength oxymetazoline and you stop it, sometimes you feel worse than you did while you were on it or even before you used it. And it can also irritate the nose. What we do at Allermi, we compound nasal sprays with tiny micro doses of oxymetazoline, which is really effective because it opens up the nasal passages so other ingredients can get back there. And studies have shown that when you combine oxymetazoline, even at standard strength, with a nasal anti-inflammatory or a nasal steroid, the nasal steroid kind of mitigates a lot of or kind of takes care of a lot of the side effects that you would see with the oxymetazoline, meaning that you don't see the rebound anymore and you don't see as many of the side effects. So combining it with other ingredients has been shown scientifically to be very, very helpful. And we do that in most of our Allermi, or if not all of our Allermi sprays, depending on what your symptoms are. And it's been found to be really, really effective for a lot of our patients. So other questions are, what causes nasal polyps and what is the best way to treat nasal polyps? So when I describe nasal polyps to people, I always tell people that oftentimes when you get swelling on the inside of your nose, and that swelling gets really, really bad, what can happen is that tissue can kind of form like little dumbbells, and it can make like a dumbbell shape that falls into the actual nasal passage. And that is termed as a nasal polyp. And so anything you can do to decrease that inflammation in the nose helps the polyps, get better and sometimes even resolve. A lot of the current treatments for nasal polyps, I mean, there are a few out there. A lot of them are aimed at really getting that medicine far back into the nose so that it can reach that polyp and help it, resolve or shrink. And so our Allermi nasal spray, because it has an ingredient that opens up the nasal passages, the medications can get back there, and oftentimes it's very helpful for nasal polyps. What exactly causes postnasal drip? So there are many things that can cause postnasal drip, but the way to think about it is that anything that can irritate your nose or anything that can cause nasal inflammation, so that can be allergies, like environmental allergies, like pollen, like tree pollen, cat pollen, dog dander pollen, dust mite pollen, grass pollen, all of that can cause nasal inflammation. And when that happens, the cells in the nose start to get very activated and they make things. So they make mucus and so to try to clear all that stuff out. And in doing that, you get that postnasal drip. Let me look. I'm just going to look and see what other questions are out there. One question is that how a lot of people, my patients ask me, like, how can this be about the nose when all I feel is a dry cough, like nothing's coming out of my nose? So how can my cough be due to my nose inflammation? And so what I often tell them is what happens is that whatever is triggering the nose to be inflamed, let's say it's environmental allergies, is causing that nose to be so swollen that all that mucus that wants to come out can't come out of your nose, so it goes on the back of your throat. And you feel like you're having that dry cough or that irritation or that tickle. Oftentimes when your nose gets swollen, it's really hard to tell. Like, you can't tell because you can compensate. So if you can't breathe the one side, you'll breathe through the other. And if you can't breathe through the other side, you'll just start to mouth breathe. It's only when it gets so swollen that all that drip that can't come out goes backwards that you really start to feel other symptoms like sinus pain and pressure or like that tickle or cough. Yeah, so let's see what other questions people have. What about chronic postnasal drip? Any relief? Again, we sort of just talked about this, so I'm sorry if I'm being repetitive, but postnasal drip is happening because all that mucus that wants to come out your nose can't, so it's going backwards on your throat. So anything you can do to open up that cute little nose of yours so all that mucus comes out this way instead of going backwards, and anything that can bring down that inflammation, which will decrease the mucus production, will be super helpful. Someone asked the question, my daughter has been on liquid Zyrtec for probably 2 years. In the last 6 weeks, she's had increased irritability and agitation. I've seen a lot of parents indicate Zyrtec can cause behavioral issues for kids. I'm wanting to try an alternative to see if this may be connected to what's going on. I'm looking for trying chewable Claritin or another over-the-counter chewable recommendation. Okay, this is my recommendation. If your little girl is having all these symptoms where she is getting, nasal congestion or eye symptoms. Remember, the nose and the eyes are connected. So when the nose gets swollen, there's a tube or a duct that goes to the eyes. That tube gets swollen and the eyes get really itchy. I do not recommend using a pill. It will make her feel less itchy, but it will not make the main problem better. The problem is in the nose. So anything you can use that directly goes to the nose will, one, work better, and two, cause less side effects. And so I found for the nasal spray that they tend to like the most is the Flonase Sensimist. It's the blue one. It's not the green Flonase. The green Flonase has alcohol in it. It's like, it smells like flowers and it's super irritating. But the blue Flonase feels like a puff of air. And so when she uses it, or when you use it for her, over time, it will help that inflammation go down and it will be helpful for her. So that's something you can consider. I rarely ever recommend Benadryl for environmental allergies. I always call it like a dinosaur medicine because it's been around for so long. But yeah, Benadryl is like riddled with side effects. The Zyrtec, at least it's a second generation antihistamine. It's cleaner than the Benadryl, but then again, I think a nasal spray would be the best. Is there anything that works for allergies besides Claritin, Allegra, Zyrtec, and Xyzal? Again, as we just talked about, like they are oral antihistamines. They will make you feel better, but they're not making the root problem better when it's an environmental allergy. So definitely stick with nasal sprays. We tell our patients to combine nasal sprays, combining like an antihistamine spray, which you can buy actually over the counter, like Astepro, with an anti-inflammatory spray like Nasacort or Flonase Sensimist is really helpful. Because one works really fast and one works really slow. And so combining them together, they complement each other really well. And so that often really does help symptoms. You can also try our Allermi Super Spray, where we're like sort of go to that next level where we're able to combine different ingredients in different amounts depending on what your symptoms are. And that can really be helpful because it kind of really gets at the different things in your nose that are causing all these problems. How can I unplug my ears? Again, everyone has it's called eustachian tube dysfunction when your nose when your ears are, feeling like they have to pop or you feel uncomfortable. If sometimes with allergy, that's due to that back pressure. So when the nose is swollen, all that stuff is pushing on your eustachian tubes. So anything you can do to get that nose better and get everything to come out this way oftentimes helps the ears over time. Some people say they take Zyrtec daily, but I noticed after a few days of consecutively taking it, I'm just so tired and dry. I'm increasing my water intake, but I can't seem to ever get past a few days. How does anyone deal with this? It depends why you're taking the Zyrtec, right? If you're taking the Zyrtec for your pollen allergies, it's just going to make you feel slightly better. But again, it's riddled with side effects because you're taking a pill that goes everywhere in your body. So you're going to have more side effects. So again, I would just recommend trying a nasal spray or a combination of sprays, either from over the counter or our Allermi Super Spray. Let me see what other questions you guys have. I'm trying to think of other questions that I also hear a lot of. What helps the forehead pressure? I think it's because the barometric pressure, along with worse seasonal allergies from fall starting. I'm already on Flonase and Loratadine daily. I don't really like Loratadine. Loratadine is the generic for Claritin, and it's not a very strong oral antihistamine. Some people really like it. I guess people who aren't really used to taking allergy meds find it to be effective, but I tend to find that it's a very weak antihistamine and it's not super helpful. A lot of people do combine that with Flonase, and that's sort of a standard that a lot of the primary care docs recommend for environmental allergies. Cut the Loratadine out, like try to do like either a nasal antihistamine spray like Astepro, and combine it with a gentler anti-inflammatory spray. Like don't do the regular Flonase, do like the Flonase Sensimist or the Nasacort. That combination often works better. And then if you want to go a step above that, you can obviously consider our Allermi Super Spray, which has helped a lot of people. Let's see what other questions we have here. What happens when you begin taking an antihistamine every day? Antihistamines are notorious for causing people to feel really dry, like dries up like your nasal passages and your mouth and your eyes. And so a lot of people complain about that when they're on um, oral antihistamines. They can also make you feel a little sleepy. Like I want to say like about 1 out of 5 people feel really sleepy with Zyrtec. More than that feel sleepy with Benadryl. Benadryl is notorious for having making people feel sleepy. Those are probably the most common side effects with the oral antihistamines. How to help an itchy throat. I hear this often, and it's all due to that nose inflammation kind of extending out. So sometimes you'll feel that itchiness when all that postnasal drip goes on the back of your throat. Helping the nose, making the nose better, will help all those other symptoms get better too. My nose is congested and my ear feels muffled. I had an ear infection in one ear, which got better now, but it is muffled in the other ear. I have been on 3 forms of antibiotics, now on another strong nasal spray. Nothing is working. I have seen my ENT and waiting to do a CT scan. So yeah, definitely work with your ENT. I think that's important. You want to make sure there's nothing anatomical or structural that's making it so that your sinuses are more prone to getting mucus, plugging, or congestion. But for a lot of people, it really has to do with everything backing up from the nose. Think about a combination of nasal sprays or using the Allermi super spray to really open up that nose so everything drains out this way instead of going backwards. That's a very simple solution that requires the least amount of medicine that can be super helpful for people. Oh yeah, what also really helps too is to use a saline rinse. So before with our Allermi super spray, we always include a saline spray, and it serves 2 purposes. One is that when you do a couple squirts of the spray on each side, it kind of loosens up all that stuff in your sinus passages, so that when you blow it out, everything is more likely to come out of your nose instead of going backwards. And it also keeps everything nice and hydrated and moist, so that when you use a medicated nasal spray, it won't irritate the nasal passage. It's much less likely to irritate the nasal passages. Perfect. I have asthma related to allergy. I have bad blocked nose and sneezing and runny nose. My IG test results were quite bad. And dyes, these allergy meds have a long-term side effect. So again, nasal sprays tend to be the best because they don't really get absorbed by your whole body. They just get absorbed by your nose. So really think about doing a combination spray or combining a few sprays as we talked about. That could be really, really helpful for you. I'm sorry that your IG test results aren't so good. You could also think about allergy shots. Allergy shots are when we mix up everything you're allergic to and you get small amounts of it, but it is a commitment. It's usually once a week for 6 months to build up to a top dose, and then it's once a month after that. But for a lot of people, they do really well. Usually after a year, they can cut their meds in half or go off of them completely. And usually after 5 to 7 years, like they're done. So that's something, a good long-term plan. Allergy shots will take a good year or so to kick in. So doing like a combination of nasal sprays in the meantime might be really helpful for you. What are my thoughts on turbinate reduction surgeries? I'm not an ear, nose, and throat doctor, so I don't really have like such an informed opinion about that. But I can say that oftentimes my patients who do get nasal turbinate reductions along with allergy shots do really well. Chronic postnasal drip, how can I eliminate this? Again, getting the nose better will get that whole the postnasal drip getting better too. I've had issues with Allegra not dissolving in my stomach. Was that a known problem or just me? I don't know. Everyone does differently with different medications. I usually tell people though to always take the oral antihistamines with food because sometimes it makes people feel nauseous. Is there a spray they say not to take more than 3 days because it makes things worse? That would be the oxymetazoline that you can buy at the drugstore at full strength. Again, because it's full strength and it's not combined with another like anti-inflammatory, it can cause you to have that rebound where you feel worse after you stop it than before you started it. And so at the drugstore concentrations and not combined with another medicine, I would not recommend the decongestants at the drugstore. With our super spray that we have at Allermi, again, we've studied this really well and we've looked at the scientific literature using micro doses of it and combining with an anti-inflammatory oftentimes makes it so that there are very little to no side effects with it and people do really well. Itchy eyes, mostly when mold is high, does standard help? The eyes and the nose are connected. So when the nose is swollen on the inside, there's a tube or a duct that goes to the eyes. That tube gets really swollen and then the eyes get really itchy. So if you get the nose better, you get the eyes better. So a combination of nasal sprays really does help with the eyes, especially ones that contain olopatadine or azolastine. Those are allergy medicines that are in nasal sprays that sometimes get into that duct and really helps with the itchiness. Help for chronic postnasal drip, nasal sprays. Hives. Moved to Northern California, and now I have hives. I feel like my face is filled with antihistamine. My skin itches. I was told possibly urticaria. Definitely see like an allergist. They can help you, right? Or see your doctor, your regular doctor. The way to think about hives is that you have a glass that's full of protection that protects you against getting hives. But there are things that take away from that. Like if you're sick with a cough or cold, you pour some of that out. If you have bad environmental allergies, you pour some of that out. If you have sensitive skin, you pour some of that out. You have to get a doctor to help you address each and everything so you can build back your protection. And then they can help you kind of reset the immune system, because when you get hives, it means that the allergy cells in your skin are super activated. They're like on fire. And so every little thing makes it worse. So scratching sometimes will create a hive, or if there's pressure like around where your waistline is, you'll get really itchy because of that constant pressure. Or when you're lying down and you get up from bed, that pressure will cause you to feel itchy. Trying to reset the allergy cells often really helps. And so getting a doctor to help you with that is might be really helpful for you. What do you think about Zysol pill at bedtime? It seems to help the most with azolastine during the day. You know, the Zysol is just going to make you feel better. It's not going to make the problem that much better. I usually try to avoid oral antihistamines for environmental allergies. Azolastine is an antihistamine nasal spray. It is helpful, but it's really short acting. Like when you use it, you feel it right away, but then the effect goes away after like 2 hours. So if you're going to use azolastine, great. You can use it morning and night for most people, depending on people. Again, I'm not giving medical advice because, I haven't seen you as a patient, but just in general, the use of azolastine is helpful. And combining it with an anti-inflammatory can be helpful too. What are my thoughts on turbinate reduction surgery? Again, I'm not an ENT, so it just depends on the person and what their problem is. Some people do really well with it, but again, if your nasal turbinates, which are the inside of your nose, are swollen due to allergy, then you can get the turbinate reduction. It's just going to come back again. You have to do something to prevent the allergy. Combining the nasal turbinate reduction with something long-term like allergy shots is super helpful for people. But again, it depends on the person. Cough attacks in the middle of the night while sleeping. Again, that can happen because all that mucus that wants to come out can't, so it's going on the back of your throat. And when you lie down, it pools, and then you end up with that cough. And so trying to get your nose better would really help. Some people also have a dust mite allergy, and so their symptoms get worse at night. Dust mites, you can look it up. There are these little microscopic creatures. They live in very humid environments. They love bedding. And so getting the special covers, the dust mite covers for the mattress and pillow really helps them. Sometimes getting an air purifier also really helps too. Washing the sheets in hot water once a week is also very helpful. A lot of people do like the Navage. I would say sort of along the line of using like a saline spray, or some people even do the neti pot to rinse out the sinuses. That's helpful. It like rinses everything out. But again, if your nose is so swollen, the nasal saline and the Navage won't actually open up the nose. So sometimes you do need a medicated nasal spray to open up the nose. So actually that saline, the salt water, can get back there and really rinse everything out for you. Sorry, I'm just looking at whether questions people have. I stopped eating a lot of food when my nasal polyps shrunk immensely. Still got them, but small enough to where I can breathe better. Okay, good. Some people say that certain foods do get them more congested. There could be a couple reasons for this. One could be that people have this sort of reflex where when they eat, it's called a gustatory rhinitis. When they eat, they get more congestion. I've also found that certain foods that might be pro-inflammatory, when you already have existing inflammation, sometimes makes that inflammation worse. It's not a true allergy to the food. It's just that when you're really, really swollen already, certain foods can make that worse. I feel extremely lightheaded when my allergies are bad, no other major symptoms. That could be from sinus symptoms, right? Sinus pain and pressure can make you feel tired or groggy or lightheaded. So that could be the reason you have that. Can seasonal allergies cause tingling in the mouth? I mean, everyone has different symptoms, right? We're all different. So yes, I've heard that before. You can also have something called an oral allergy. It's when you have such bad environmental allergies that you get these crossover reactions with a lot of fresh fruits and vegetables. So whenever you eat that fresh fruit or vegetable, you get like itchy or tingly around where fresh fruit or vegetable touches the mouth. If the vegetable is usually cooked or processed, it changes the protein so you don't react to it in the same way. So I don't know if that's what it could be, but that's a possibility also. You can't comment on the post right now. Let's see what's happening here. Someone also said they lost their sense of smell like 5 years ago and they had polyps removed, but then they came back. When you have nasal polyps, it's because the inside of your nose gets so swollen that tissue kind of like forms like a little dumbbell type of structure and it goes into your nasal passage, and a lot of people lose their sense of smell. Sometimes you can get that removed and it helps, but if it's due to allergy, it's just gonna all come back because that polyp happened because of swelling, and if you still have allergies, even if you get it removed, that swelling is just gonna come back and possibly cause polyps again. So the real thing is to really address the issue of why, what can I do long term to help me with my allergies? And so definitely talking to an allergist and seeing like what good long term options there are might be really helpful. Those are all the questions that we had. Feel free to, check us out. We're www.allermi.com. We have a really great group of people who've really benefited. It might be hopefully beneficial for you too. Feel free to reach out to us. We're always here to help. We want you guys to live the best life that you can. We know that allergies can be really, really hard to deal with and can really impact your quality of life. So we hope that, that we can help. Nice to see you guys. Have a good rest of the weekend.